We appreciate Dr. Constantine George's knowledge, and he's going to talk about a very important issue that's affecting many of us, probably already has you. Flu and the flu season. It is just a mess this year, doctor.
It's here big time.
Yes, and it's not going away for some of us. So let's just get right into it. There's some of it, there's just basic things that we can be doing, right?
Correct.
Just to kind of protect ourselves.
What I tell patients, the biggest preventative thing is get your yearly flu vaccine. There's a lot of misconceptions about it. You cannot get the flu from the flu vaccine. So get yourself immunized, your entire family, number one. Number two, stay hydrated. Number one, the big thing is keep your hands clean when you're at work or if you're around public places. Keep your hands away from your face. Hand wash your hands all the time. We don't think about simple things, cleaning off your phone, your computer, your mouse, because your hands are there and inadvertently you touch your face. So it's all about risk reduction, risk prevention when you're talking about the flu.
The simple things that you don't think about, just disinfecting constantly, staying hydrated so you don't get, dehydrated, and also hand washing, very important. I always heard say the alphabet a couple of times and you should be good.
At least 15 to 20 seconds and then I'll try to do it. So.
All right, there you go. I deal with like words, not numbers, so that's why I just kind of sing songs. Okay, so I want to talk about, because people are kind of confused too, because they say, oh, okay, well, I got the flu shot, and then sometimes you may still get the flu because there's different strands, right, out there.
Well, the thing to understand is when you get the injection, you can get flu-like symptoms, but it's not actually the flu itself. The other thing with the flu vaccine, the Centers for Disease Control and the World Health Organization try to predict on a yearly basis what strain will be the most prevalent.
Okay.
So we're not always the best at getting it 100%. But even if you have one year where it may be 85% effective versus another year where it's 33% effective as an example, you're better off getting that vaccine because you're better off having 33% protection than zero protection that 1 year.
That's true. And then do they also have this kind of updated version of essentially kind of the Tamiflu, where if you take it, it kind of lessens the severity of the symptoms?
So when you get diagnosed with the flu, obviously, see your provider, there's a certain time frame within which we can prescribe Tamiflu or antiviral medications to kind of subside some of the symptoms that you're having. Because the thing that we worry about is the complications of the flu itself. Pneumonia, bronchitis. People die, unfortunately. Up until last week in Clark County, we've had 14 deaths, 2 of which have been children, unfortunately, and over 400 hospitalizations because of the flu this year alone.
So we have to remember those vulnerable populations and everyone else, just being mindful of these tips and things that Dr. George just shared with us. Dr. George, we appreciate you coming by, and hopefully we're going to stay healthy.
Appreciate it.
And we're going to wash our hands,
exactly.
right? And stay with us. We'll be right back.
Thanks.